Because so far we took care of diabetes, DKA, we know why. We took care of kidney failure, we know why. We did our respiratory already this morning. We have diarrhea left over, sepsis left over, poisons and toxins left over. Now I need you to tell me, why do you think sepsis is on the board?
Uric acid is not,
I heard your comment. What did you say?
when uric acid is not coming out, it's going back into the blood.
With sepsis? No. Who wants to take a stab at it?
Because of the blood pressure. Wait, I'm sorry. Because the fluid controls the BP and there's no output. I'm probably saying it wrong, so blood pressure while we're now making sense.
Well, sepsis doesn't take fluid out the body. Anybody else? She said that, multiple organ failure, but I need to know why, not what, and that's what you guys just gave me when you said multiple organ failure. That's better. No, that's the answer. When you're in sepsis, aren't you going into shock? And doesn't shock have a low blood pressure? And now we have no BP, no PP. Remember, everyone, if you look on the back, the very last page of this packet, there is a poster that I did for the Cleveland Clinic. It is the #1 poster that year. I beat out everybody in the whole world, not the country, not just the country. So I beat out Abu Dhabi, I beat out London, I beat out Nevada, Florida, and everyone in Ohio. So my partner and I took on a poster presentation that won first place. That's because we pointed out that sepsis kills more people than a heart attack, a stroke, and cancer combined. But yet we don't treat it like an emergency at the hospital level. So now you have a code sepsis, right? You have to understand that this is like a code blue before you lose your heart rate and all that good stuff. Okay, so you'll see my name right on there. And my partner in crime is Joe, and Joe just got an award this year. And both of them work on the #1 unit. All of these people work on the #1 unit that I send you guys to work on, because it is the most amazing unit at the clinic, okay? So if you look, this patient is at risk for going into shock. Now, I want to point out one big deal thing to you. Under the background, your job on this test is to remember sepsis outnumbers heart attacks and strokes as the #1 cause of death. And then if you go a little bit further down, what is your role, nurses? You see the very next bullet point. Early detection and timely antibiotic administration is key in preventing what? Organ failure and death from sepsis. And then in #3 bullet point, in 2021, 36% of patients at Cleveland Clinic main campus did not receive antibiotics within the first hour. So if you go all the way over to the graph, it's hard to see, but my results after doing an extensive educational campaign with all the nurses on the unit, and this is stuff you are gonna be doing, big shot stuff. So if you look at what we did on our unit, the outcomes, within the 8 weeks during the pre-intervention and post-intervention period, there was an increase of compliance from 73 to 93% with the new sepsis best practice action of administering IV antibiotics within 1 hour. Your job is to understand that if you have a patient that is going septic, you need to administer those antibiotics within 1 hour of the order. But here's our deal. How will you know your patient is going septic? Well, let's go back to page 10. because I gave you everything you need to save a life. In the Oh My God packet, you will see on page 10 that it's not just hypovolemic shock, but it is also septic shock. Does everyone see that? Okay, what's the big capitalized letters? What's capitalized? Bullet point number 2. Low BP. Now, all shocks kind of look alike when it comes to blood pressure, but you're not going to be that confused, because you're going to understand, yes, shock does look alike. It really does, but they are very different. How would you know this shock apart from all the others on the page? This one has a high fever, because what is sepsis? Infection on crack. That's all it is, right? It's infection to a higher level, to an extreme amount. Okay, so that's a big deal for you to know, because of the deaths from sepsis being ignored largely for years, the Ohio Board of Nursing is focusing on sepsis and your early recognition of the signs of sepsis. So this is simply on here because it can lead to septic shock. And all shock has a low BP, and when you have a low BP, you have a low PP. So it's all about, once again, kidney failure. It's not respiratory, is it, guys? It's the other one, metabolic. Okay, now, poisons and toxins, those are a little bit difficult. I want you to look at the picture in your acid base packet, and I want you to notice how they wrote, it's a bottle of it, if it might have slipped you by. It's a little bottle. It says ASA. What is that? Exactly. It is the legal abbreviation for aspirin. Highlight that, because that goes over here in the poisons and the toxins and the overdoses and whatnot. But it's a little different than the respiratory depression experienced by opioids. This aspirin issue is straight. What did the 3 letters stand for in the abbreviation of aspirin, the whole ASA? Acetylsalicylic acid. So what we used to see, and we don't see it as much, but what we used to see, and I will say I was guilty as a kid, we was kind of poor, so candy wasn't coming nowhere near us, but we did have some baby aspirin. How many of y'all know baby aspirin tastes strangely like orange Smarties? Oh, okay, it's good, it's tasty, it's delicious. The kids ain't getting no candy. So honey, we was like, yeah, ain't nobody got no fever, let's go and eat this. In other words, we had so many children overdosing on acetylsalicylic acid. And when they came in, they were not in respiratory acidosis, because does aspirin suppress the respiratory system? No, not at all. They were in metabolic acidosis because of the overload of acid in the body. Does that help a little bit? Now, here's the last piece. The Poison Control Center can tell you right up front, because as you know on this test, when they say, how does the nurse teach the parents to prevent poison in their children? You know the answer is lock it up, not put it out of reach. Don't even think about it. Lock it up. And then you also know that when they say what is the first nursing action to teach a parent with a child that has ingested a poison or a toxin, you know it's called the Poison Control Hotline, not give syrup of Ipecac, right? Because what the Poison Control Hotline will do is ask you, what is it that your child ingested? And they will help you get it treated immediately. Well, they will tell you right off the grip, if it is a poison or toxin, the biggest risk to your child is that this poison or toxin will poison the body in such a way that gives it an acidosis. Also, they will tell you that it causes kidney failure, because in this case, you killed the nephrons of the kidney. Sort of like taking an antibiotic called aminoglycosides. Who remembers that? Aminoglycosides, vancomycin, toxic to the kidneys. Does that ring a bell to anybody? Okay, it's the same shit with poisons and toxins. Whether it's antifreeze, whether it's bleach, whether it's, shit kids get into, soaps, Tide Pods, whatever it is, it's gonna throw your kid up into some kidney failure because you killed that kidney with that toxin.
So let's say on the test it has like hotlines and it has the actual antidote. We know that's the antidote for it. Would we still choose the hotline?
I've never seen that, but I would choose the hotline. Yeah, I would never ever see that in the same question. What they will have is call 911, and that's not the answer. The answer is called poison control hotline. Because they know exactly. So, everybody's kid do some stupid shit. So I panicked because I found out that my child, I think she was 3 years old, and boy, that the poison control hotline put it in perspective for me, made me feel so much better. Like literally prevented me from running to the hospital hysterical. Okay, because when you're a nurse, that doesn't mean anything when it's your kid, right? So my kid, it turned out, ingested the birth control pills that I never even thought, just laying on your dresser, right? Never thought of. And if you know anything about birth control pills, they have a tiny hint of sugar in them, the green ones. And then the outside ones have a little tiny hint of sugar. Only people who took it without water would know that, but whatever. So here we go. The kid done took some damn birth control pills. So here I am, panic-stricken, calling what? Poison control hotline, thinking, yep, you're going to jail, bitch. Now, so I talked to the poison control hotline, and this was their first comment. I got good news. You said it's your daughter, right? I said, yes. They said, okay, well, she's a girl. Estrogen ain't gonna hurt shit in a little girl. I said, oh, because what is a birth control pill? Estrogen. Good night. Have a good one. I would have ran to the hospital if I didn't know as a nurse. Don't even bother. Call poison control first. And it just made everything so much better. I didn't feel bad even after that night. I just put them up from now on. But it could have been worse, right? It could have been that they want you to call 911, and until they get there, they want you to do A, B, C, and D. That's how good they are. Does that help a little bit? So remember I said that for your test and for real life, because shit be happening, life be lifing. So poisons and toxins kill the kidneys. Technically, sepsis lowers the blood pressure because you're getting into shock, but it also is a toxin and a poison because it's a bacteria taking over on your body, so it does a double whammy to your kidneys. So that's kind of important. Now, the favorite, you have a favorite up here on this board. The favorite is diarrhea. And I make life easy. If it comes out your ass, it's acidosis, okay? It don't get no better than that. You're not gonna miss this on a test ever. But then I wouldn't be me, a scientist, if I didn't tell you how. So let's talk about how. You have two issues. You have vomiting, which is on this side of the board, and you have diarrhea, which is on this side of the board. When you vomit, you throw up hydrochloric what? So you're over here because you got rid of acid and all you got is that. Are you with me?
Yes.
It's completely different with diarrhea because diarrhea does not come from the stomach the way vomiting comes from the stomach. The stomach is hydrochloric acid, not the colon. In fact, the colon, as I stated when we started this lecture, is alkaline. I told you the stomach was acid, the colon was alkaline. So when you have anything coming from the colon, which in this case, diarrhea always comes from the colon, specifically diarrhea comes from the small intestine, and that's important because you have something called a large intestine and a small intestine, and they are very different. Diarrhea comes from the small intestine. In fact, I taught you that part of the small intestine called an ileum. In boot camp, I taught you that an ileostomy was diarrhea in a bag. So when you have diarrhea, you are pulling all the fluid and all the nutrients out of your ileum, and that's your small intestine. So when you pull those fluids, the fluids in the small intestine are different from the ones in your stomach. These are acidic, this is alkaline. When you pull all this alkalinic fluid out, you are left with acid. Okay, it's kind of like harder to understand because it is diarrhea and people don't know anything about their small intestine. And this one's easy to understand because everybody understands the stomach has hydrochloric acid, which is why we give you the rhyme. If it comes out your ass, it's acidosis. Okay, so don't sweat it too much, but understand there's always a rationale to everything I say, okay? All right, so then boom, you did this entire acidosis. You know the pH is less than 7.35 on that patient. You know that many of these patients, depending on what's going on, are going to be ordered an A, B, G. And so that when you come back next week and we do this side, which this will stay on the board because we have to do this side and it's really complicated on this side, you'll understand that's the whole alkalosis part, and that pH is higher than 7.45. Now,
Okay, so you said it's acidic if less than 7.35. What if you 7.35?
oh, I'm glad you asked, because if you have a patient on your test, and you will, who is 7.35 to 7.45, and boy, is this a really good question. If you have that patient, it is said that they have been fully compensated, and that's defined as a normal pH. But then when it comes to figuring out like which side they lean more towards, you just have to look at which one they're closest to. So if they were 7.36, 7.35, 7.37, then they are fully compensated. Which side are they leaning? Acidosis. Okay, now if it's a respiratory issue, then they are fully compensated respiratory acidosis. If they're 7.44, 7.43, 7.45, fully compensated, which way is it leaning? Alkalosis, right? Yep, you got it. Okay, let's go. You got some cauliflower to do. Now,